You are about to review the appointment scheduling workbook. There are two ways to access the appointment scheduler. You can access it by either selecting the blue hyperlink calendar on the upper left or by choosing the first icon that is the little calendar icon. I prefer to choose the blue hyperlink because it will actually open up the same provider that you have on your desktop view. You'll see that whenever you open up your scheduler, it brings up a day view. You also have the ability up top where you can see a work week, so you can see 5 days at a time, or you could even see a Sunday through Saturday schedule if the practice sees appointments on the weekend. We're going to stick back to the day view, and we're going to show you truly how simple it is to schedule an appointment. Within this whole thing, we want to show truly it's going to be one click, one touch access to schedule an appointment. I can select the time. From this point, I'm probably going to fill in why the patient's coming in. We're going to say it's a follow-up. And then we can search from our patient list and we can schedule an appointment. You will note that since it's an integrated system, whenever we come in here to schedule an appointment, we do have the ability to see any future appointments that they have, and then we can also come in here and see if there's maybe any health maintenance roles that are due. We can see right now that this patient has a complete physical that's going to be due in September of next year. If it is something that's overdue, it will show up in red, and then we can make sure that we get that appropriate appointment scheduled, which is going to improve the patient care, and more importantly, it's going to also bring in some more money and more revenue into the practice. Once we're done with this appointment, we can choose OK. And now the appointment's scheduled. You'll see that our appointments are color-coded based on appointment type. This can be customized per the practice. The other thing that can be customized is the amount of time in the practice. You'll see that in this example we have 15-minute slots. Okay, so you can customize this to what the practice needs, but more importantly, if we want to schedule an appointment that needs to be a half hour, we want the system to use its adaptive learning and to automatically know that. So for example, if I come in here and you see appointment type, my appointment length defaults to 15 minutes, but if it's a new patient, you'll see it automatically changes to 30 minutes. So it's a great way, since we know our highest turnover position is going to be in our front desk, to make sure that they're adapting to the workflow that the practice uses. So let's go in here and let's finish scheduling in that appointment. Once we're done, we can choose our OK button, and that appointment's now. Now, something that you're going to see, and we're going to talk here a little bit, is about the actual waiting list. This will give you the ability where if you do have last-minute cancellations, you can make sure that you get those appointments scheduled in there. As easy as it is to schedule an appointment, it's just as simple to cancel an appointment. Any appointment that you want to cancel, you can just select that appointment. Once it opens up the slot, you might see a pop-up message coming up here. Maybe they're in collections. Here's where you can change the appointment status in here to canceled or no-showed based on whatever you want as a practice. Okay? So it's very easy maneuvering and working your way through the system. One of the other big things that we want to talk about is what we call resource scheduling. Resource scheduling is going to be specialty specific, but it gives you the ability where if you have a specific piece of equipment or a specific room that you want to use, that you can use and track that. What I'm going to do next is I'm actually going to open up two calendars. I'm going to see my X-ray calendar. This gives me the ability where if I do need to block off a room or a specific amount of time for that, I can do that all in one step. So let's say that a patient's coming in maybe to see even a nurse tech and they want to block off both calendars at the same time. I can come in here and I can select my 11 o'clock appointment. Where I have this resource, this will actually let me link this appointment to multiple calendars. So I can come in here, I can type in X-rays. We'll say what are they coming in for. They're going to come in for a procedure, or actually even an X-ray right in here. And then we can select an appointment. Once we select our patient that's coming in here, and we'll put X-ray and office visit. Once we choose our OK button, watch what it will actually do. Not only does it schedule it in Dr. Wyckoff's, but it will also schedule it over here in X-rays. So it's a great way to be efficient and make sure we get the most efficiency and utilization out of your scheduler. The last thing that we want to talk about in the scheduler is our waiting list. Why our waiting list is important is if you think on average we have around 10% of our patients that might cancel at the last minute or even cancel within 24 hours. This wait list on the left-hand side gives us the ability where if we do have last-minute cancellations, these are patients that want to be seen a little bit sooner. So we'll see right here, it will actually put them in order based on urgency that we set up in our system. And if we do want to schedule Daisy Duck, we can actually come right in here to this appointment. And from this point, we can actually select a new appointment and find that open time that we have. So this is a great way for not only patient satisfaction and revenue, but it's a great way to keep your doctor very busy. The last thing that we would want is a doctor spending, 30 minutes at the end of the day sitting around doing nothing. So we're going to come in here, we're going to schedule in this follow-up appointment, we're going to say that they're sick. Those are going to be some of the actual main features that we have in the system. One of the main goals, if you're ever showing the appointment schedulers, we need to make it look as simple as possible.